Hello. We are here at the WFNR-EFNR Regional Meeting in Baku, Azerbaijan, which is jointly organized with the 19th Congress of the Society for the Study of Neuroprotection and Neuroplasticity and the 19th International Summer School of Neurology with Professor Antonio Federico. Dear Professor Antonio Federico, as chairman of the specialist group on rare neurological diseases within the World Federation of Neurology, could you share with us your perspective on the current status quo within this field?
Yes, this type of disorder that are rare disorder and also called orphans disease because they are orphans of specialists that are involved in this disease and has the knowledge of diagnosis and treatment, and they are lacking mainly of therapies. So orphan drugs now is one of the possibility to discover new drugs for rare disease that are increasing in the number in the recent year and give an opportunity for understanding also the physiopathology of this disease. In the World Federation of Neurology and in other societies in which I worked, we founded a study group on this disorder because we are convinced that it is important that general neurologists have some knowledge of the approach of rare disease and became available some possibility of early treatment and early therapy for this disease. This is not true in all countries and there is a big discrepancy in Europe, for instance, between Eastern and Western countries, and in the world we have a total area in which it is not possible a diagnosis of such disease, and it is necessary to improve the knowledge of general practitioners and general neurology, and also to establish a network between expert center and other centers in which it is possible to send samples for DNA analysis, for biochemical investigation, for a secondary opinion about a disease, and then establish an algorithm for diagnosis and also some guideline for treatment.
All right. You have developed a very advanced research center at the University of Sienna in Italy. How much has this impacted the Rare Neurological Diseases Research Network at the European level?
Yes, it is more than 40 years that I have been involved in rare disease, and I consider rare disease as a Pandora box for neurology and for neuroscience. This is important because rare disease represent a very nice model for understanding the brain function and brain dysfunction. When you miss of a gene, you, through rare condition in which this gene is underexpressed, you will develop the role of this gene in brain function. So this is a beautiful model for understanding the brain function when the gene exists, and brain dysfunction when this gene is not exist. So it's is a big approach to neuroscience that are given by this model that the nature offer to us as a model for neuroscience.
All right.
And we have developed many techniques for investigating rare disease, and we discover new disease like some form of Parkinsonism, some form of mitochondrial disease, lysosomal disease, and we were one of the reference center for cerebrotendinous xanthomatosis. That is a very beautiful model of aging, general aging, because it is characterized by many symptoms that are present during aging. For instance, cataract, osteoporosis, dementia, and it is a treatable aging disease, because if we treat early this condition, we avoid all symptoms and the patient go on by treatment without any symptom.
What would be the main elements needed for a reasonable development regarding access to quality care and improved outcomes for rare neurological diseases patients, considering the discrepancy between high and low and middle income countries?
This is a big problem in which I think that the artificial intelligence and telemedicine could be a big support for this, and it is necessary that in such region the culture, the information about this disorder is important, but it is not possible that a practitioner or a general neurologist will know everything of the more than 6,000 diseases. But he needs the information where it is possible to check this problem. And it is important that he learn how to approach the reference centers that are present in Europe, in the world, and how to contact with them. And the internet will open new frontiers, and now it is possible through internet that it will be possible also to have a teleconsultation of patients, a second opinion about this patient, and you can send samples to the expert center with sophisticated techniques for diagnosis, and finally to have the cure. The problem is for therapy, because the therapy is very costly, and in such region it is very difficult to have some government support for this disease, but we hope that in the future it will be possible even in Africa, where this problem is very high than in other regions of the world.
What do you believe to be the added value of the teaching course on rare neurological diseases in Central Asia, and how could this be capitalized at the local level?
Yes, I think that is important, because open the mind about a model of function and dysfunction of the brain, in which we know the pathogenesis of this condition, and enrich the neurological culture in a topic that was neglected for a long time, and that now with the new techniques of genetics, neuroimaging, neurophysiology, and neurorehabilitation can open a frontier to help this patient that is considered without hope and without any possibility of treatment.
All right. Thank you so much, Professor Federico, for being here, and thank you for the interview.
Thank you to you.